All right, just wrapped up week 3 out of a 5-week surgical rotation as a PA student. I just wanted to make this video to anyone interested in surgery, to talk through my experience as a PA student in surgery. Just got out of a long day, a lot of different procedures, and wanted to talk you through how I enjoyed it, things I liked, things I didn't like, and what to expect as a student going into surgery. So whether you're a PA student, nursing student, med student, this I think will be helpful for anyone really interested in it. I wanted to make this just so I have a recollection of my time during surgery, and also for anyone interested in potentially going into surgery, what to expect, what I went through, and hopefully tips and tricks that you can learn and hopefully take from this. So my time in surgery has been really good overall. I can't really complain. I've worked a lot of primarily with residents and some doctors, but mostly residents throughout my time. And I've been thankful enough that I've had some amazing residents with me, a lot of them who are willing to take the time, willing to teach, and that's been really helpul. And so I've got to see a bunch of different procedures, things ranging from gallbladder removals to amputations. Those are probably the craziest things I've seen. Below the knee amputations for a couple patients. A lot of patients had osteomyelitis, foot ulcers that didn't heal. And so we actually had to take a lot of their lower extremity off. And that was kind of a crazy procedure just to see and be a part of. I actually got to use a bone saw for that. And going through the bone, that was pretty crazy. And seeing how they tied it up and sutured it all together. Very cool process, very interesting process. Saw a lot of other cool things too. A couple of GI related procedures, things along those lines. But primarily as a PA student, what you're doing is a lot of observing throughout these weeks of rotation and a lot of just small closures. So getting good at suturing before this is definitely very helpful, but I'm not saying you're going to be doing a ton of suturing from a PA student perspective. A lot of just small closures here and there. A lot of robot surgeries are done, so laparoscopic procedures, and for those, you're closing the port sites after the ports have been removed. Not very much that's going on there from a surgical perspective that you're doing, but still cool to be involved a little bit in the care. Other things that you'll do are holding things, holding retractors, helping cut things, helping occasionally help with different types of other sutures. And so it really depends on what you're allowed to do. I got lucky again that I got amazing residents that let me do a lot more. And so your surgical experience will depend on really who you're with, whether it's a good doctor or a little bit more of a strict doctor. Getting to understand how they operate is really helpful for you. So you can not only do what they want, but are able to do a little bit more and push yourself, hopefully, if they allow you to expand out of your role and do a little bit more as a student. And so, well, surgery has been really interesting and really cool, seeing a lot of different things in my perspective. I feel like it's not something I personally would love to do long term, especially just given the fact that a lot of the times you're seeing patients, they are heavily under anesthesia, sedated, and so you're not actually interacting with them one-on-one. Obviously, outside of post rounds, things like that, you're really just dealing with the procedure part. I really like personally the outpatient clinical side of having a relationship with patients. So from that perspective, I am not the most interested in surgery. But that being said, the hands-on aspect of it, being able to actually get in there, fix up a problem right away, I found that to be really cool. To trying to do different procedures, being able to operate with a whole team of different individuals, NPs, anesthesiologists, doctors, resident nurses are amazing, and a lot of the staff really works as a whole unit. It really does feel like a team when you are in the operating room. Everyone's there, everyone has a job, everyone operates together, and you all work in correspondence to really get the job done. And so that part of it is cool, feeling you're working together with the team to accomplish a goal, and it's really satisfying when that comes out properly and successfully, and you actually do get that successful result with the surgery. So that has been cool to see that side of it. But just from my perspective, again, primary care, I think something more outpatient is a little more interesting to me, having that relationship with patients. But definitely something I wouldn't consider, but definitely something I might consider in the future, to have a little bit more of a hands-on approach to care, whether it's small and office-based procedures or things along those lines. I think that could be something very interesting for me. That being said, a couple tips and tricks to be good in your surgery rotation, or just if you're interested in surgery, a couple things you should probably brush up on. Number one is just practicing suturing. So whether that's simple buried, subcuticular, any type of basic suturing methodologies that you can really get good at, I would recommend doing that. Hand tying too as well. You can look up videos for single hand ties, double hand ties. That's been really helpful for me because going in, I was not the best at suturing. So getting good at that throughout the process is very important. And then the other thing, making sure you're able to willingly ask questions and act engaged throughout all procedures, even before and after. I would recommend looking up and researching different types of procedures you're going in to see, whether you're just a PA student, med student, nursing student, whatever. Having an idea of what you're looking at, the anatomy behind your structures that you're looking at, all that going into it is very beneficial. And then also just having a awareness about the room. So whether it's a doctor who is very talkative, willing to answer questions, willing to have you ask questions, or whether it's someone who's more serious, more strict in their operation, going in and out, not really talking as much. I've worked with both aspects of different doctors, and balancing the way you ask questions, the way you approach the doc in that situation, I think is a skill, and that's very important in surgery, just so that way you can get the most out of your experience without being too overbearing and asking too many questions, because doctors and surgeons really don't prefer that either. So getting good at reading the room is definitely a huge skill in these different types of situations, and I think if you take the advice that I've said into account and really just operate based on your provider you're working with or the resident that you're working with, I think you'll be just fine as a PA student or any other student going into surgery. So again, I just made this for my memory so I can look back and see how my time was in surgery as a PA student, just for my memory there. But that being said, don't feel hesitant to reach out with any questions, or if you want to know a little bit more about the side of a PA student in surgery or even PAs in surgery, I'd be happy to reach out and talk to you about my experience and give you tips and tricks from everything I've encountered. So that's really what I wanted to get at. So thank you.